right, everybody, welcome, welcome, welcome. Uh, Today, what I want to talk about is my job and what I believe my role in this community is when treating people and athletes. First, I want to talk about my business card. My business card says that I'm a chiropractor, an owner and operator of a company called Minnesota Movement. That's all fine and dandy, but it's just a title. I still show up to work in gym shorts or joggers and a t shirt every day because I like to, because I get to, because it's what makes me feel comfortable. What I get to do then is work however the heck I want to work. I think this is paramount in letting me render the best care possible with the clientele that I'm working with. My point to bringing this up is not conforming to the norm, which goes into my role as a chiropractor. I don't enjoy the idea and I don't see any benefit of the idea of just being another cog in the wheel or another chiropractor that does everything that another chiropractor does, or what we would standardize as the role of a chiropractor. Not to say that that's a bad thing, we'll touch on that here in a second. There's a big, big, big benefit of being just another chiropractor. So don't get me wrong, and don't let me put you off with that. What I'm getting at is what else? What happens when somebody doesn't get better under that care? Or we could think of this even outside the chiropractic realm. What happens when somebody doesn't get better under an orthopedic surgeon's care? Well, there's conservative measures like us that they can take, or before that care, potentially and hopefully, right? So, what I'm more so getting at is the role that I fill and what I believe my job is in this community. So let me start this conversation with I believe the role of any healthcare provider, whether this is pain, prevention, performance enhancement, anything, should be to work ourselves out of a job. If I'm doing a good job at my job, I should be seeing fewer and fewer people, not more and more people. Now, thankfully, job security wise, this isn't how it works because life happens and people get injured or people have issues all the time. Or they focus on the idea of prevention and performance, and thus they keep coming back. But my intent of rendering care with individuals is to give them the empowerment and the ability to stay out of my clinic as much as possible for as long as possible. Now, for the treatment, as a chiropractor, we always think of adjustments, right? I can snap and crack your spine, and you're gonna feel better because this magical thing is released like a small dove coming out of your body, and these gremlins inside are gone and rid from your body forever. And now this nervous interference is out of there, and you're gonna be able to function optimally with this whole pin, clothespin idea, whatever the hell you wanna think of. Sure, that's a tool, okay? Do I use it sometimes? Yes. But let's take the cervical spine, for example. If we're thinking with a joint by joint approach, the cervical spine actually needs more stability. So if I'm snap, crackling, and popping people's necks because it has this cool sound and they get this perceived benefit from it, but they actually need more engagement of deep neck flexor and extensor musculature, aka stability and motor control, the mobility that I introduced might not be the right answer. An adjustment is just one tool in a chiropractor's toolbox. Sometimes, for some chiropractors, and this is fine, it's the only tool that they have. Hopefully, or at least I would hope, if that's the case for this chiropractor, they're damn good at using that tool. Okay? If I'm a carpenter and all I have is a hammer, I better be pretty damn good with using that hammer. Even if I have a screw in front of me or any other sort of fastening utensil, the hammer could get that screw into the wall or into the wood, but it might not be the best tool for that job, right? So, what I like doing, and thankfully the way that I'm able to practice and function, is using whatever tool I deem, or the patient deems, or research deems, or evidence deems necessary to help provide a solution for that individual. Okay? So, what I'm getting at here is the idea that bones only move, or we can only adjust a bone based off of the surrounding tissue, the surrounding musculature, the surrounding skin and fascia, and all of this tissue, right? Those tissues only move because the brain said so. So ultimately, what we're treating most is the brain's allowance for more movement capacity. It's for this reason why I think it's important that we address the start of everything, the brain, the person attached to the movement capacity that we're trying to influence. If we can alter or provide more trust of these movement patterns because the brain said so, or mitigate the pain because the brain said so and it isn't perceiving so much stress threat from this area or this movement pattern, perhaps these muscles are going to move more efficiently or more fluently. Perhaps these muscles are then going to pull or create less tension or tightness through your upper traps and therefore mitigate the pain. What I'm getting at here is our tagline, or my tagline, I should say. Fix the why. Why is this issue there in the first place? Let's address that. Let's start there. Okay. If we can address why that issue is there in the first place, follow that pathway down, the issue goes away. Hopefully, that's the intent, right? If we're really, really magically good at our jobs. What I'm getting at is we have to realize and understand and appreciate who the victim is and who the culprit is. And sometimes, if you're only using one tool, an adjustment that I'm picking on right now, you might be missing the victim versus culprit conversation. You might just be smashing the victim when it's already over abused. So, getting back to this idea of understanding the person that's attached to this meat bag that we call a body, okay? This meat bag is not just made of meat, there's a bunch of other stuff in it, lots of water, and nerves, the brain, right? The brain isn't just a feeling receptor, it doesn't just take in information from my big toe when I step on a tack or something like that or stub it. It also has a personality with it. So, what we have to understand is how this person's fears and where their goals are with their movements allows us to tap into that to inspire them, to empower them, to give them more trust moving into these directions, to achieve their goals and mitigate their fears and take those away so that they're able to do what they love doing. Ultimately, what this allows us to do is keep them out of our clinic, which brings me back to the whole point of this conversation. If I'm doing a good job at my job, I should be keeping people away from me, not forcing them to come back to me every 2 days or 2 weeks or whatever it is. Now, like I said earlier, shit happens and people get injured and people have issues or they're focusing on performance prevention and they keep coming back anyways because they trust what I do is going to be the solution for them, right? So being able to provide a specific tailored solution to their specific tailored issue or symptom, we could call it, is paramount. So, to summarize this, what I want to get at here with this whole barrage of comments about chiropractic and adjustments and tools and stuff like that is my role as a provider is to get people moving and feeling better. I do this by finding and addressing why that issue became a problem in the first place and attacking that first in order to get my patients and clients out of the clinic for as long as possible doing what they love doing.